morning, everyone. My report is about alpelisib Piqray. Piqray is a prescription medicine used in combination with the medicine fulvestrant to treat women who have gone through menopause, women and men. Initial US approval is 2019. Therapeutic indication. Alpelisib is indicated in combination with fulvestrant to treat postmenopausal women and men with advanced or metastatic breast cancer. This cancer must be hormone receptor positive, human epidermal growth factor negative, and PIK3CA mutated. So, fulvestrant is a medication used to treat hormone receptor positive and human epidermal negative, advanced for breast cancer. Mechanism of action. Phosphatidylinositol 3 kinase is responsible for cell proliferation in response to growth factor tyrosine kinase pathway. In some cancers, PI3KA or phosphatidylinositol kinase A is mutated, making it hyperactive. Alpelisib inhibits with the highest specificity. So the target of this drug is the phosphatidylinositol 4,5 biphosphate 3 kinase catalytic subunit alpha isoform. So the PI3KA that phosphorylate phosphatidylinositol 4 phosphate and phosphatidylinositol 4,5 biphosphate to generate phosphatidylinositol 3,4,5 triphosphate. So the PIP3 or the phosphatidylinositol 3,4,5 triphosphate plays a key role by recruiting pH domain containing protein to membrane, including the activating signaling cascade involved in cell growth, survival, proliferation, motility, and morphology. Participate in cellular signaling in response to various growth factors. So the action of phosphatidylinositol is it inhibits. Dosage information. Piqray tablet is a once daily oral tablet that is prescribed with fulvestrant. Fulvestrant is an injectable hormone therapy. How should I take Piqray? Take Piqray exactly as your healthcare provider tells you. Take it once a day about same time with food. Can I change my dose of Piqray? Do not change your dose or stop taking Piqray unless your healthcare provider tells you. What if I miss my dose of Piqray? If you miss a dose of Piqray, you may still take with food up to 9 hours after the time you usually take it. It has been over 9 hours after you usually take your dose. Skip the dose. Take the dose at your usual time the next day. Do not take 2 doses to make up for the missed doses of time. If you vomit after taking Piqray, do not take another dose that day. Take your next dose at your usual time. So, if you miss and if there is adverse reaction like vomiting, it's advisable to do not take and take it another day at usual time. Can I chew or crush my Piqray tablets? Swallow Piqray tablets whole. Do not chew, crush, or split them. Do not take any tablet that are broken, cracked, or that look damaged. What if I take too much Piqray? If you take too much Piqray, call your healthcare provider to go nearest hospital emergency room right away. Pharmacodynamics. Electrophysiology serial ECGs were collected following a single dose at a steady state to evaluate the effect of alpelisib on the QTCF interval in patients with advanced cancer. QTCF is an electrocardiographic finding in which the QT interval corrected for the heart rate using Bassett formula to shorten. Pharmacokinetics. Alpelisib has been studied in healthy subjects and adult patients with solid tumors. Steady-state alpelisib maximum plasma concentration and AUC increased proportional over the dose range of 30 mg to 450 mg, 0.1 to 1.5 times the approval recommended dosage under fed condition. The mean accumulation of alpelisib is 1.3 to 1.5, and steady-state plasma concentration are reached within 3 days the following dosage. So the the plasma concentration was 2,480 within 23% per ml, and the AUC 24 hours was 33,224, which is 21% per ml. And advanced improvement applied. The Solar 1 study designed for cohort with PIK3CA mutation or phosphoinositide 3 kinase. So, PI3K, also called phosphatidylinositol 3 kinase, are a family of enzymes involved in cellular function such as cell growth, proliferation, differentiation, motility, survival, and intracellular trafficking, which in turn are involved in cancer. So, the alpelisib is for treat for the cancer. So, the improvement that they made is the alpelisib itself with combination with fulvestrant is for postmenopausal women and men. So, they advanced it. The advanced study, they used the Solar 1 trial for the metastatic advanced breast cancer. So, they used was randomized double-blind placebo-controlled trial plus Piqray plus fulvestrant versus placebo plus fulvestrant and 572 patients with human receptor positive and human epidermal receptor negative advanced or metastatic breast cancer whose disease had progressed or recurred or after an aromatase inhibitor based treatment. So this is the example, the progression-free survival in Solar 1 per investigation assessment of patient with PIK3 tumor mutation. This result is after the aromatase inhibitor based treatment. So as we see, there is alpelisib plus fulvestrant, placebo plus fulvestrant. So from the 100, the time, so pababa siya until the time or per month goes on. So the alpelisib plus fulvestrant has activity in patient with PIK3CA mutated, HR positive, HER negative advanced breast cancer that has progressed during or after treatment with an aromatase inhibitor. Comparison with the other same class of drug without technology. Alpelisib compared to idilasilib, both phosphoinositide 3 kinase inhibitor, both combined with another drug. So, alpelisib is combined with fulvestrant, idilasilib is paired with rituximab. Idilasilib is indicated at treatment of chronic lymphocytic leukemia, relapses follicular B cell non-Hodgkin lymphoma, and relapses small lymphocytic lymphoma. For the treatment of relapses, CLL is currently indicated as a second-line agent in combination with rituximab. Conclusion: alpelisib and fulvestrant is tolerated and improves outcome in patients with HR and MBC. Alpelisib and fulvestrant could be an effective therapy in patients who would also progress on systemic chemotherapy including CDK4/6 inhibitor. So, CDK4/6 inhibitor currently used to treat metastatic breast cancer are these drugs are used in combination with hormone therapy to treat hormone receptor positive HER negative metastatic breast cancer. So, the fulvestrant and alpelisib is effective in therapy in patient if they undergo CDK4/6 inhibitor like abemaciclib, palbociclib, ribociclib. These drugs are used to combine with fulvestrant. That's all. Thank you.